Coach, I don't feel good.
Get a shot, take it.
The tragedy you've just witnessed, for me, is very real. In a gym very much like this one, I was sitting in the stands on January 22nd, 1999, watching my son Adam play basketball when he suddenly collapsed and died. In his case, there was no defibrillator on site, and as a result, he was denied the best possible chance for survival. The hope through Project Adam is that the next child who suffers an incident like my son Adam will in fact have the best chance of survival, where my son did not.
The Project Adam program was developed by Children's Hospital of Wisconsin to increase the availability of automated external defibrillators in public buildings. Children's Hospital's Dr. Stuart Berger, a pediatric cardiologist, directs Project Adam to help prevent scenarios like you've just seen.
Not all episodes of sudden cardiac death are preventable because many of the kids do not have symptoms until they have the episode of sudden death. Therefore, it's been our feeling that we need to be in a position where we can intervene rapidly and effectively. So Project Adam has been designed with that in mind, and the project is an educational project in which we teach CPR in the schools, we teach the children, we teach the teachers, the students how to use automated external defibrillators. And the reason for that is if the kids cannot be discovered before an event occurs, if we're in a position to intervene very rapidly with CPR and with defibrillation, it's going to be the biggest likelihood to get these kids through and to survive. Sudden cardiac arrest doesn't always occur with sports. It's often that it does because this is the most intense time, the time that the heart is working the hardest and the time that it puts the largest strain on the heart. We have discovered several children who have had a coronary artery abnormality. And what happens in those children is that when they exercise, the coronary artery gets squeezed between the great blood vessels and causes a lack of blood supply to the heart. And that could be a cause of fainting or symptoms occurring with exercise, and actually is certainly one of the causes of sudden cardiac death. We've been lucky enough to discover 2 kids like that. They can go to the operating room, they can get this corrected, and the successful correction of this will allow them to lead a perfectly normal life. All of the kids who are at risk of sudden cardiac death have an underlying cardiac abnormality. If you have a normal heart, this is something that can't happen to you, and the majority of kids have a normal heart. Certainly nowadays, athletics are emphasized. The goal is to win and to work hard, and kids do that, and they work very hard. So certainly the intensity of the exercise is great, and that typically is important, but you do have to have the underlying cardiac abnormality in order to put you at risk to begin with.
To ensure that these kids are fine, schools need to have an automated external defibrillator program in place and staff who are trained to use these life-saving instruments.
I think one of the big questions that almost every school has that we've been involved with is the safety of the device. What if I use the device incorrectly? What if I shock someone and they don't need it? Can I cause damage in such a situation? Well, as it turns out, these devices are fully automated external defibrillators, so you can't use it incorrectly. All you need to do is learn how to put the paddles on correctly. The machine will do everything else. It won't possibly allow you to shock somebody if a shock is not appropriate.
In the end, you could be responsible for preserving and saving a child's life. The key is being prepared.
Get back, guys. Are you okay? Call 911 and get the AED. Come on, buddy, breathe.
Apply pads to patient's bare chest.
He doesn't have a pulse.
Connector
Give me the pads.
next to flashing light. Analyzing
Okay,
heart
stay
rhythm.
clear. We're going to analyze.
Do not touch the patient. Shock advised.
Okay, we're gonna shock. Stay clear.
Charging. Stay clear of patient. Deliver
I'm
shock
clear, you're
now.
clear, everybody's clear.
Press the orange button now. Shock delivered.
Check for pulse.
He's got a pulse.
To learn more about Project Atom and how you can implement a public access defibrillation program in your building, call 414-266-3889 or visit the Children's Hospital website at www.chw.org.